And we do that on-site databases, or we do online HIPAA compliant databases. And it has really been my pleasure to work alongside, to learn, to teach alongside Dr. Shalvanyazi and Dr. Michelle Sweeney, who are emerging leaders in Indigenous Data Sovereignty Work Group. And that has just brought me a wealth of information as a non-native. And in addition, I've also been able to start with our tribal Prams, which is the Pregnancy Risk Assessment Monitoring System that we've started from the very beginning. So I just want to start there with my introduction and really just thank you for the opportunity to share what I have with you all of you today. And it's really my honor to work forward with many talented natives, although as a non-native, I do find it very intimidating. And but Michelle always reminds me that we need our non-native allies. So I'm hoping that I will continue to be a strong non-native ally. So these are the objectives that were given to me to try to go over today. And I want to say that I'm probably the most comfortable with the first one, talking about data ownership, data sharing agreements, and tribal sovereignty, data sovereignty, because those are the things that we do. We try to really walk our talk at Aztec when regarding those. But I will talk about partnerships and some of the things that we've had to overcome as a tech center, and the partnerships and trying to be recognized. And then I also will try to illustrate the importance of policy, although I feel like many of you will already know that. So let's first go into the next slide and just really talk about data sovereignty. And I don't normally read a slide out when I do it, but I feel like this is so important that I'm actually going to read the first sentence of this. And it is, Indigenous data sovereignty is the right of a nation to govern the collection, ownership, and the application of its own data. And later in my presentation, I'll talk about the uses of data, but I'm sure that you know how data is presented writes the narrative per a group of people, and the narrative that might stick with them, whether or not it's true. So this is a very powerful thing. And I do believe it starts with all of those things and why it's so important to think about it. And I got this definition, as you can see below, from that website. The next thing, I need to go to the next slide and talk about what I feel is really important and the difference between data sovereignty and data residency. It's because it's really the heart of data sovereignty is who has control of the data. It's not where it's stored. So a lot of times we feel like states, researchers, different people who feel like because they're collecting it, they own it. That's not data sovereignty. It's really the Indigenous data sovereignty is, this is data about us, then we should have control over that data, whether, like I said, the collection, the application, and what's being done with that and how it's being presented. So they are not equal in terms. I also like to just go over a few things because this is my area of expertise. So, you know, data residency can also be a data repository, but we also have things like data stewards, data librarians, and data custodians. And I just like to do a little bit of education on those because I just feel like that's just something that's so important. So if you go to the next slide, you can talk about data stewards and data librarians. I feel like I am both at Aztec at different times. So a data steward is someone who is concerned with taking care of a data set, looking at data quality. So I see somebody who, let's say, is involved in taking care of tribal enrollment, and maybe they do an update twice a year, and they make sure it's clean, they make sure they document every birth, every death. If somebody is no longer living within the community or come back to the community, they take care of that. And they really work with the data quality to make sure that they have the most up-to-date tribal census. Whereas a data librarian is responsible for managing, archiving, and retrieving data. And one of my biggest wishes is that every tribe will have access to a data steward or a data librarian, actually both. And I would like to see our tribal epicenters be that for them if they cannot do that themselves. Because wouldn't it be really nice to have one person who or a group of people, you know, like a data librarian, who has control over every grant proposal, every report. One place, if somebody comes in and does a survey, they can already get their hands on this information, archive it, and know where it's at. So it's not sitting locally on somebody's computer that may or may not be there in a few months. So this has really been my wish. I really like doing that. I really appreciate those communities who entrust us to hold their data and understand that it's not our data, but take care of it for them online, so we can have that for years and years and years going forward. So if you go to the next slide, my last bit of definitions that I really want to go over, and this is something I think about if I'm doing data collection or if I'm actually looking at data. So they're both ways, and you just kind of think about it. So whenever I think about it as who needs the data, so who needs the data also kind of says how the data might be collected, why it was collected. This is really important. If I'm looking at somebody else's data set, I want to ask these questions about that, because it sometimes will show whether or not there might be bias in the collection process itself, as well as how is it collected. We talked about race misclassification, and how is it collected? Is it self-reported, the race? Is it somebody going in, taking a look at somebody in the hospital and saying, okay, I'm going to assign this race to them. This has happened. We know it's been happening. We've had studies that have done that with data linkages and hospitalizations, as well as vital records. So we know that happens. So how it's collected, I think, is really important. How it's analyzed, again, it's through the lens of whoever's seeing that is really important. And so I like to look at, many epidemiologists will probably tell you, we don't like to look at reports as much as we like to look at methods and raw data. So we want to be able to look at it again ourselves and come up to the same conclusions because of that lens. And then how it's going to be reported. Again, I wanted to say, who reports things out is the one who controls the narrative. That's why we feel at Aztec that data sovereignty for Native Americans is so important, simply because we've known so long that the narrative isn't being presented always in a very good light, isn't being presented even with tribal input. It's just being presented in ways that somebody who sat back in an office who may or may not have any idea about what's going on does this information. And I don't think I really need to give anybody examples of how this has been done in the past, because I feel like you all know it, you've lived it, and know what the consequences have been because of this. But I really think that the who, why, and how are really important questions to ask, whether you're collecting the data or whether you're examining data that's being collected for you, like our, hopefully we'll have a tribal-led MMRC will be doing, because this will help them look at what the data says and what's going on. Okay, so I know I'm going pretty quickly, but before I go any further, I do want to go ahead and go to the next slide. And I made a slide just to sort of stop and say, you know, this is a lot. There's a lot of definitions about data sovereignty and what's being done about it. And I wanted to see if there was any questions or comments, just to kind of give you a chance to take a breath, but all of you to think about what this is and what this means, and if there's any questions or comments or discussions you'd like to have. I will rely on Maddie to read anything in the chat, because I don't think anything's going to pop up on my screen.
Yeah, absolutely.
Okay.
Erin said, thank you for representing the Tribal Epidemiology Center point of view very well. I think that's crucial. If you have any questions or comments, just feel free to unmute yourself. But I'll keep reading them out in the chat as well.
Okay. Like I said, I know that this topic of data sovereignty is really new, but I think it's one that we all need to sort of rally behind. Of course, I have some great people that I work with that are doing this kind of work, because it's just, I just feel like we've had misrepresentation for a really long time. Not trying to carry any shame with my my race, but when knowing that this has happened, and understanding the importance of this work. And if anybody has any questions, you can offline, you can always contact me. I will put you in touch with either Dr. Swaina or for Dr. Yazzie and the work that they've been doing, and how maybe you can get involved if that's what you want to do. But
it looks like Jane is asking, how do you protect the importance of this? And this, I'm assuming, means data. Do you use contracts or memorandums? And then we'll go to Sharon, who looks like she has her hand up.
Okay. Well, we do a lot of this through data sharing agreements, in which I will talk about next. I mean, we certainly do memorandums, but I think a lot of it has been just because of we've tried to really build up our trust and really stand by our data sharing agreements, where we will keep data for tribal communities, and particularly the work that we have done with them, whether it's an adult survey or a child survey. But at the same time, we are somewhat gatekeepers. We still don't want to impede anybody within a tribal community from getting the data, as long as we make sure we're allowed to give it. So it's really building trust. It's over a decade building trust with the communities that we work with, as well as data sharing agreements, which we will, I'll go into next. Go ahead.
Yeah, I just you expressed the idea of a goal or hope that all tribes, every tribe would have their own, at least steward, if not, and librarian as well. I'm just wondering what you see as barriers to your goal becoming realized. Is it a funding thing? Is it just not recognized as something that is supported by money that is available? What kind of barriers are preventing your dream from becoming reality, I guess?
Thank you. Yes, I think there's a couple of different things. One is I think that technology has caught everybody by storm, and they're working feverishly to get caught up technology-wise and not really being able to understand that, as well as the funding. You know, one of the things, we get a lot of funding from our different grants, and we have a forward-thinking director, Kevin English, and he makes sure that we have a lot of money so that we can do these databases, so that we can keep them for a long time and do this thing online so that it's kept in a cloud. You know, I've just noticed and experienced myself where if it's on one person's computer or we lose that person, they go to a different job, we've lost everything that may have been that work that that person has done. And so I don't think it's been recognized. And like I said, I don't think we've caught up. Our tribal communities have been able to keep up with the technology. I know I scramble to keep up with technology, but I think it's both of those things.
Thank you.
Okay. Okay, I'll go on to data sharing agreements and what we've been doing at Aztec. So if you go to the next slide, please. Okay, so really, a data sharing agreement is really this formal contract, and I feel it's so important because it tells how the data is going to be used by the receiver or the person who's holding it. So it's the owner telling the person who's, like I said, the collector or the repository, how they can and cannot use their data. I feel this is so important. It sets the boundaries. It also sets up a legal paperwork so that, you know, we don't keep a database online or keep data from a tribal community until we have a data sharing agreement with tribal leadership. We just want to make sure they know we have it, and we know what we're allowed and not allowed to do, because I feel like it's really important. So if you go to the next slide, I want to talk a little bit about institutional review boards. They are not a substitute for a data sharing agreement. We like to think of our IRBs, particularly the Southwest Tribal IRB, which is housed at our Indian Health Board, but they're not a substitute for a data sharing agreement, because they don't always look for the interest of that tribal nation. And I believe that if there's a good IRB, particularly if it's an institution such as a university or a state college IRB, they should make sure there's a data sharing agreement with a tribal nation before the project is ever approved, because that way researchers know, just because they collect it, just because it's their project, it's not their data. They can't publish without the approval of the tribal nation if that's what's already written in a data sharing agreement. So I just wanted to make sure I put that out there. Again, this is my own view, but I do strongly believe it. So let's go to the next slide, which talks about the elements of a data sharing agreement. I think these are really good parts of a data sharing agreement. It should be for a period of time, hopefully, particularly if it is a research project, but otherwise it also should be something that doesn't go on forever, so that tribal leadership will be asked to renew it and they understand the importance of it. So we need to do that from time to time here at Aztec. We need to know what is the intended use of the data. Before I go too much further too, I want to make sure that everybody understands one of the reasons I want to go through a data sharing agreement elements is because a tribal-led MMRC may have to state what their intended uses are, because they need to sign data sharing agreements in order to get certain data, particularly from states. So you need to know what the intended use of this is going to be. The constraints of the use, like I said, being able to publish or not publish without prior authority from whoever the owner is. They should also talk about data confidentiality. What's it going to do if members of the MMRC are going to be asked to sign a confidentiality agreement? Even if you don't ever know who this person first or last name is, you may know particular facts about it, so that you might be able to point that person out. So you ensure we have confidential agreements written into the data sharing agreement, what's going to happen there. Data security. We found that people like to do things by Zoom. We're meeting more in person maybe right now, but a lot of these Zoom meetings I see being carried forward, particularly if it helps with costs. So how are we going to keep our data secure? How are we going to share that method and make sure that it is secure? Is there going to be a place where we can have that? Again, the funding for a tribal-led MMRC hopefully would be able to look at that and have places where people can go in and look at it if, like I said, not everybody was going to be meeting in person. Then the next thing that we always have to think about, and I know this is crazy, but what are the financial costs of this data sharing agreements? And sometimes it's actually, what is the cost of the data? We do a youth school behavioral survey. We call it the YRRS, the Youth Risk and Behavioral Survey with the state of New Mexico. We have to pay for them to oversample our Native American students so that we can provide a more comprehensive report for the people with whom we serve at Aztec. So, and then it's not the only databases that we have to pay for. And of course, just like I said, there might be other financial costs that are involved in this data sharing agreement, which means having to pay for security, methods of sharing, and those other issues, as well as if this was going to be a research project, with the community in which they're doing the research project, are they going to be paid for their services? Okay, so next slide, please. So one of the questions might be is why have a tribal-led maternal mortality review committee? And this is something I tell everybody, this little statement when I'm doing their analysis is, remember, nobody knows your data as well as you do. This is something, it's through your lens, your knowledge. I've worked with so many different tribal communities and programs, and I'll analyze their data, but I'll say, please don't distrust my work as an epidemiologist. First of all, I do make mistakes from time to time, but only you are going to be able to find those mistakes. You're only one that's going to be able to see if there's a gap, and being able to ask those really informative questions that I can't, because I'm just looking at data. It's, yes, I realize there might be people behind it. I mean, I never think about, oh, you know, if I'm looking at something particularly as important as this information would be, that this would be, you know, somebody's daughter, mother, aunt or sister. But at the same time, these are things that it's data. I don't have the context that we were talking about in the other, the panel. That is so important, context. And I think it's really important. And that's why I feel like this would be so helpful, is we can't just pull it out and figure out that if we do this as a dry sense of analysis, we're probably not going to have anything meaningful. But I think if we do it for the thoughtfulness that has been shown already in our talks, this could be something that's so valued. Even if the tribal-led maternity mortality review committee reviewed cases that had already been reviewed by states and did their own review and their own reports, I still feel like that would have tremendous amount of value, because it's done through a different lens, through a different process, and hopefully with a lot more representation that needs to be there. So your next slide, please. Okay, so partnerships. Partnerships are hard. I don't think there's any way to put that out there. These are some partnerships that I was thinking about, what we probably need. But you know, what we've had to do at Aztec is really cultivate our partnerships. And sometimes we have to kind of sidestep our partnerships. We've been doing a tribal Prams work for a long time. So we feel like we have great partnerships with our maternal health partners at the state of New Mexico. Not so much I can't remember, the public health department piece of because there's two divisions of public health there. But we have really good partnership for it. So if there was information, I wouldn't necessarily go to the state epidemiologist right away for this information. I would go to the partner that I feel had the information and work with them to elicit help from the state epidemiologist if that was needed for permission to do the work that we need to do. And knowing that is really important, which means that, like for myself, I've been at the Tribal Tech Center for over 10 years now. And I feel like I've cultivated these relationships. I know Kevin English has cultivated these relationships, and we know them. And I tell you, if somebody came up to me and said, we really need to work with this, and I felt like I had that in, I would sit there and go, sure, I will help you bridge that partnership, help you get where you need to be, whether or not you knew what to do. Because when you go in blindly, we all have these barriers of trust that we face. And it's all about this ownership of the data and who feels like they're in a better place to guard the data. We've had some butting of heads when it comes to that. And it's really been quite interesting. I've worked with one tribal community where they were working with an epidemiologist at the State Department, and she really worked hard, but it's like she wouldn't talk to me even though I was being on a committee. I was there in the room with the people within the community that I was working with, tribal community, but she wouldn't really talk to me. So I would have to sit there and say, okay, this is what I need as your epidemiologist, because I'm working for you, this community. I need a data dictionary. I need to know this answer. I need to know these years. And so it was kind of this funny, weird thing where she wouldn't talk to me, but I learned that I had to do it this way because we just needed the data and what happened. And so we just played the game until we earned the trust of that person that no, I wasn't going to just keep it on my computer and use it how I felt like it. I was there for a particular reason. I was being contracted by this community to do this work and needed to earn that trust. And so it takes a really long time. So I kind of think about all of these areas and all of these as allies and partnerships that we would need. IHS, absolutely, within the medical community. But I can tell you right now that I know of no IHS run hospital that actually provides any sort of birth in the state of New Mexico. So if a tribal-led mother or a Native mom needs to give birth, they're gonna go to either private or a state-owned facility for that work. Whether we do have midwives, but we do know that there aren't any IHS facilities for that woman to go to. And we need to work with all the other places that might have that information. And we might need a data sharing agreement with all of them and how that would take place. And just being patient. And I like the idea that was said that we need 10 years to do this. I would say 10 years to really cultivate these partnerships before we're even going to see any results of what our review committee could do. Because I feel like not only can we point out disparities, but we can do something even more so, is we can point out all of those positives that make a big difference and why, and ask those questions of why that might be different. So if you go to the next slide, we'll just talk about policy. And I don't have anything on there but just policy, because I just wanted to kind of talk about, a few things that went into it. So how Michelle Sweeney got into really working on policy and the work that she does with Indigenous data sovereignty is because our New Mexico Health Department wanted to reclassify Native Americans if they said that they were both Hispanic and Native American. So prior to their work, if anybody said they were a Native American, didn't make any difference. If they said they were Hispanic or not Hispanic, they were going to be classified as AI. Suddenly they decided the New Mexico Department of Health wanted to be in queue with the CDC. So if anybody also marked Hispanic, they were then going to be Hispanic. They were no longer going to be classified as AI. So we did some work on that at our center, and we found out that would basically, digitally annihilate 20,000 Native Americans within New Mexico. And Michelle really worked on this and worked to try to get together a policy. And we advocated for any time they do surveys and they ask about race, they also ask not only are you Hispanic or non-Hispanic and there are other races that you can pull, but which race do you most identify with? This is really important. And this is a policy that goes deep, and it really makes a big difference when it comes to allocating of funds, showing a need. Another policy that I wanted to talk about that happened quite recently, and you may have heard about this in the news, is a local policy that one of our hospitals had in the beginning of the pandemic. We had a hospital who, if someone identified as AI and they put down their zip code and they looked at it, they would, and once they gave birth, they separated their mothers, the mothers from their infants until their COVID test came back. They didn't do this to any other race, but they did it to AIs. And so we can see that is still going on. We still need to worry about these issues because, that was what, 2020. It was called to attention. This hospital was called out, But again, there's a whole lot of mistrust that this hospital has put out there within the whole medical community. And so we need to make sure that policies are really important. And this is something that came to my mind that is just, I mean, it was just unconscionable that they did this, but it happened. And it happened during the COVID because they just felt like it was they were going to do the best they could for their native moms, but by separating them until they got a COVID test back. And we know in the beginning of the pandemic, it took up to 3 to 5 days. So that meant you didn't get to bond, you didn't get to breastfeed, all of these things because of the policy. So I'm going to go really quickly over the next slide because I didn't realize we were having someone from the CDC talk about the funding. But the first thing you see is they talk about the rates. And then when I went online and said, what are they going to do about it? If you do one more click, right? It said the CDC is awarding more than $45 million over 5 years. And it's sort of like these reports, these narratives speak volumes. And it would really be nice if we had a tribal-led MMRC and we got $9 million a year, or at least a portion of the $9 million a year to do this work. And it would be so much easier to figure out how the security, what we were going to do, paying people appropriately, making sure they were, their time is going to be paid for, because I feel like this is so important. Because I want to go to my very last slide. It's because I feel like as an epidemiologist, I feel like we always need to look at what the uses of data are. They're for grants, either for writing grants or reporting. And how many tribal community programs need grants to continue and to continue the work? How many of them get a grant? They get it for 3 or 5 years. The grant never gets refunded, and then the program goes away. And they don't really get to utilize what this is. But if they have the data, they might be able to continue and get the funding that they need. So I think data is used for grants and programming. Program planning, obviously, I think it's really important, as well as evaluation. That's how we need to do the data. I feel like we don't have enough experts in this at a tribal level. That's why we have our epicenters. And we work really hard in providing help to help people with their program planning, not to do that for them, but to help them with it, as well as program evaluations. Data is always used for budgets. We see this all the time, particularly with IHS funding and who gets the money, who gets to do what. And then, of course, data is also used in policies and how it's really done and how it's put into practice. And so again, I go back to data uses is who gets to put the narrative on tribal communities is so powerful, because it's really what do you want to say? And it's not all about what's bad, because maybe what we really need is not so much change what's bad, but to bolster what's already good and going on in that community that will counteract other things that have been going on, such as historical trauma, drug use, and interpersonal violence. So I feel like these things are huge, and data can do all of these things. Of course, I'm very biased. I am an epidemiologist. I enjoy data. I enjoy looking at data. But like I said, I never forget that there's always something behind data. These aren't just numbers. These aren't just dollars. These are people and what happens with them. So I have a few minutes left, and I just wanted to go back and use that time for questions, for comments, discussions. Again, I've really been appreciative of everything that I've been able to learn from you. And so while we're having these last bit of discussions, if you would just go forward to the next slide, and people can take my contact information or ask text conference information, that'd be great. But that's all I really had for all of you today. I hope it was informative and what you wanted to hear.
Thank you so much, Judy. That was definitely incredibly informative and much appreciated. Again, please feel free to use the raise hand function. Looks like Carolyn Brewer is talking about a grant that we released earlier this year to with the purpose of conducting a self-assessment. But yes, it was a relatively low funding amount. So there is need for more increase in that realm. Anybody else would like to raise their hands and ask Judy any questions, or please put those questions in the chat.
So we're waiting. I just wanted to say, I know I threw a lot of information at people, but if you need more information about data sovereignty, please, like I said, go to our website. And then if you're also interested in how to have a template for a data sharing agreement, more than happy to share those. We do a template that we provide to a tribal community, and then we ask them to make the changes within that. But I'm happy to share our template.
Looks like there's a lot of template askings, but Cindy, if you'd like to ask your question, please go ahead.
Thank you, Maddie, and thank you for the great presentation. It's more of a comment to just jump in on the fact that we do need more funding and more funding opportunities. For example, a year or two ago, there was the tribal Prams funding opportunity that was released, but they were only going to fund 2 tribal Prams in the whole nation. And with over 570 tribes plus urban programs, it's not even a drop in the bucket. I don't even know how to put it in perspective. It's such a tiny amount of opportunity for the things that we really need. Thank you.
Yeah. So, I love the fact that we have a tribal Prams project that we collect. We've been doing it for quite a long time. And, we took a long time. I will send a template out to Maddie, and then she can send it out to everybody. So we'll make sure that gets to her within about a half an hour. But I was going to go back to the other piece of the tribal Prams. Is one of the great things, if we needed to add a question onto our tribal Prams survey, we would love to have that input from an MMRC.
Great. Yeah, that sounds good. I'll make sure to distribute. So there's a question from Kate. What is the best way of approaching data at the federal or state level about AIAN health outcomes? She goes on to say, for instance, SMM, or the birth/death of Native women in data owned by state. How should or could you incorporate the tribes or communities represented in that data, in which case a data sharing agreement with the tribes isn't appropriate?
Okay, so, in a way, I feel like if I were wanting that data, I would need to go to the tribe first and then get the permission from the state to be able to work with that data. But I think it's just one of those things where you just have to educate over and over again, and getting that information of why you need it, why you have it. I feel confident that we could probably work pretty hard within the state of New Mexico, where we, for those tribes that we work with in the state of Mexico, and get that data as a tribal epidemiology center, because we've already been working at it Colorado might be a little bit harder, but at least we know maybe how to approach them, how to get that information. And then Isleta del Sur, which is way down in El Paso, Texas. That one I have a harder time with. But I think one of those things is you just, I would never ask for data without getting a data dictionary. Get a copy of a death certificate application. You don't need a death certificate. You need the application about what they can write in each one and what they don't. And that way, when you get the data, there's going to be certain fields that are always going to be empty, but reach out to a tribal epicenter and see if you need, for those questions about, okay, what would you think? What would you feel like? I know a lot of us at tech centers, we're here just to provide technical support when it comes to data. I have at least 6 other epidemiologists. If I can't answer the question, I will pass it on to somebody and we'll make sure we get that question answered for you. So there's no pad answer, but those are some things that I would personally do.
Go ahead, Nina.
Sorry, I also just wanted to follow on to that response to some of kind of how we've approached it here at NIHB, or think about it too, is also it's about that education on tribal sovereignty, because tribal sovereignty is the base for tribal data sovereignty, and really educating partners about public health authority for tribes and for techs, and why, even though the data can, is owned by the state, run by the state, it is still information on American Indians and Alaska Natives, and it is therefore the tribes. And so we, kind of also approach it too. And I know so many groups are doing this. The techs are involved, tribes are doing this work. We are, just to really kind of also bring that education on kind of a base level of public health authority and how that plays so much into data, but also, again, other aspects of public health programming.
Yeah, thank you for. Sorry, go ahead, Judy.
I was going to say, it's definitely an education of data sovereignty that I think needs to happen. It's happening globally, but it also needs to happen at every level and every chance we get. Some things like COVID overrides us, but we still need to go back to the foundation of who really has that data, who should. It's not really ownership when it comes to residency. It's ownership of who that represents and what that means to the group in which it represents.
Got about 1 more minute or so before any last minute questions for Judy.
Hi, my name is Elizabeth. I'm a nurse with Chinle Public Health, and I have a doctorate in social policy, and actually some of my dissertation was done in Kenya in a demographic surveillance area, and there's the in-depth network that has demographic surveillance areas in 19 different countries, and there's none in the US, but it seems like as a way to exert sovereignty, I wonder whether it would make sense to get in touch with the in-depth network and see whether there's funding available to establish your own demographic surveillance area, within your local tribal area. Because at least in my experience, in the places where they've done this, they have to meet with the local groups. They have to give the data back and show what the results were and discuss it with everyone.